In this video, I will be showing you how to prepare a care plan in a tabular form using the nursing process and its component. Without further ado, what is nursing process? Root defined nursing process as an organized, systematic, and deliberate approach to nursing in partnership with the patient and their family with the aim of improving standards in nursing care. Nursing process comprises of 5 components: assessment, diagnose, planning, implementation, and evaluation. We will use these components to organize our care plan in the table. Using a case scenario, a male patient was admitted to your ward for preoperative hernia repair. The patient called on you and complains about having fear and unease regarding the surgery he is about to go through. Let us use this as our essence for our care plan. Here is a blank table consisting of the 5 components. Let us begin with one of the 5 nursing process components, which is assessment. Assessment is a systemic collection of data, subjective and objective, to determine the patient's health status and to identify any actual or potential health problem. Now that we know what assessment is, let's take this opportunity to fill the blank column on the table under assessment. On the table, when assessing a patient, we are required to obtain an objective and subjective data. The subjective data here is the information that the client or patient provides for you. The objective data here is a measurable and observable data in which you, the health provider, provides in your assessment column. When writing a subjective data, write as said by the patient. Patient said, "I am afraid of undergoing this surgery." Objective data, on the other hand, is where you would document your physical examination and vital signs, laboratory investigation. The list goes on. On the physical assessment, you assess your patient and observe that your patient had an increased heart rate, sweaty palms, and shortness of breath. This is how you will write under your objective, physical examination, and in details what you have examined. And beneath it, you can add further information such as vital signs, indicating the heart rate, blood pressure, temperature, and the respiration, and so on and so forth. After having information about the patient on your assessment column, we want to use this information to formulate a nursing diagnosis. How do we formulate a nursing diagnosis? Nursing diagnosis comprises of 3 main parts: the problem, etiology, and clinical manifestation. Before going further, what is nursing diagnosis? Nursing diagnosis is a clinical judgment about individual, family, or community response to actual or potential health problems or life processes. Now that we've also understand the definition of nursing diagnosis, let us formulate a nursing diagnosis for the patient who feels fear and anxiety. You can find a list of diagnoses from NANDA label. Go online and you would find a PDF file of the NANDA label. In this NANDA PDF file, you will find series of nursing diagnoses in which you can utilize during your nursing practice. On our diagnose column, we want to diagnose this patient of fear and anxiety. How do we write it down? We write it down as the first part, which is the problem. We say fear and anxiety. Having writing fear and anxiety as the problem. We mentioned Diagnos comprises of problem, etiology, and clinical manifestation. Now that we know the problem, what could be causing this problem? When writing what is the cause of the problem, we use related to connect the problem to the etiology. The cause of the fear and anxiety is the surgery in which this patient is about to undergo. So we will write fear and anxiety related to surgery. Fear and anxiety, the problem, related to surgery, the etiology. The final part here is the clinical manifestation. What are the signs and symptoms the patient might be facing? What are the information that you, the nurse, have gotten from your investigation during your assessment? Fear and anxiety related to surgery as evidenced by patient's verbal and physical expression. There we have our nursing diagnose. Now that we have formulated our nursing diagnose, we need to put up a plan. What plan do we have for our patient to help tackle the problem our patient is facing? Before moving further, what is planning? Planning is development of goals and a plan of care designed to assist the patient in resolving diagnosed problem. In this care plan, we will plan to assess the level of patient's anxiety. In addition, patient's fear and anxiety will be reduced after health educating the patient regarding his surgery. This is the plan that we have for our patient. Now that we have gotten our plan and our goals, we need to implement this plan and goals. What is implementation? Implementation here is carrying out the planned nursing intervention. For the purpose of this care plan, under the implementation, we will write: assess patient's level of anxiety, either mild, moderate, severe, or panic, by interviewing the patient to assess patient in an effective way to provide nursing care. We can have more implementation on the table. After assessing, we can also implement by explaining the details of surgery that patient will be undergoing to reduce his fear and anxiety by emphasizing doctor's explanation to the patient clearly and knowledge about the procedure. Now that we have conducted our implementation, this is our opportunity to evaluate the patient to see if we've gotten any progress from our implementation. Let us have a brief definition of what evaluation is in a nursing care plan. Evaluation is a regular review of the effect of nursing intervention and the treatment regimen on the patient's health status and expected outcomes. From the definition, evaluation will help us to review our patient to see if our goals have been met. Let us now see from our table if our goals have been met. Under evaluation, the patient's level of anxiety towards surgery is reduced as verbally expressed by the patient and a decreased heart rate to 55 beats per minute. From our evaluation, this shows us that our goal have been met. So therefore, this care plan was a success for our patient. And mind you, this is how you arrange your care plan in a table form to make it look organized. And I hope you like this video. If you do, give a like, comment below, and also hit the subscribe button. See you in the next video. Thank you.